Alright, for 18.3, we're actually going to split this into two separate videos. We're going to have one video focus on the arteries and another one focus on the veins and development because it's just so much. I'd rather split it for you guys so that you can not have to sit through 45 minutes about talking about blood vessels. So what we're going to do here, we're going to talk about the blood vessels and where they travel within the pulmonary circuit. We'll talk about the ones we find in the systemic circuit as well. And we'll mainly look at like the major arteries, the major branches, and the arms and legs in the trunk. We'll also have some flow charts for those. So we'll look at them like on a body, but we'll also look at like a flow chart showing how they connect to each other. We'll do the same thing for the veins, but again, that one will be in a second video so that we're not overwhelmed. So if we look at the role of the circulatory system and what it does for all these other systems, I'm just going to sum this up because this is a lot of text. And this is in your book, but I'm just going to give like the quick and dirty version of this table. So the circulatory system will help the digestive system when it comes to delivering hormones, right? As well as like ANH, right, which is secreted by the heart to regulate blood volume. With the integumentary system, it has clotting factors and platelets and white blood cells, so if we get an injury, we can repair that injury and fight the infection. It also will serve to help us maintain body temperature. With the lymphatic system, it's going to transport white blood cells around. These can then make their way to the lymphatic system. The lymphatic system also dumps fluid back into the cardiovascular system. With the muscular system, it's going to provide nutrients and oxygen for contraction and remove all the waste products like lactic acid and the heat that's generated by muscles contracting. With the nervous system, it's going to be used to help produce the cerebrospinal fluid. It's also going to contribute to the blood-brain barrier, right? And then of course all of the things that are required for the brain, the oxygen and all that will be coming there as well. With the reproductive system, this will aid in the erection of the genitalia. This is both for male and female. So in males, it's more obvious because the penis will become erect, but in the female, the clitoris will actually become erect. It also serves to transport hormones that will stimulate the gonads to produce their hormones and their sex cells. With the respiratory system, these guys work close together for oxygenating the blood. And then the skeletal system, right? This is the skeletal system is going to receive like the calcium, the phosphate, all these things that they need to build their bone matrix. Also the hormones that are involved in building that bone. And then also carry the hormones that are required to stimulate the production of blood cells. And in the urinary system, the kidneys will be involved with filtering blood, reabsorbing anything that's still useful, and getting rid of anything that is a waste product, as well as helping maintain like your blood volume and pressure by regulating how much water you release, right? And that's why sometimes you see like sometimes your urine is very dark if you're dehydrated, and other times it's very light, right, if you have enough fluids. So we're going to start looking at the pulmonary circuit first. So we've brought blood in from the body through the superior and the inferior vena cava into the right atrium and then the right ventricle. From the right ventricle is where we're going to exit from the heart to get into the pulmonary circuit. So we're going to pass through into the pulmonary trunk, into the pulmonary arteries left and right. When we go into left and right pulmonary arteries, we'll then branch into capillary beds. These are the pulmonary capillaries that go over the surface of the alveoli found inside the lungs. This is where that gas exchange will occur. And then afterwards, we've gone through the pulmonary capillaries, we'll return through the pulmonary veins, here in red, and dump in to the left atrium. Right, so those are really the main components. It's very simple with the pulmonary circuit, which is why we're going through it so quick. It's just pulmonary trunk with the pulmonary arteries, left and right, pulmonary capillaries, and then left and right pulmonary veins. So nothing real crazy with that. All right, so super short. Again, you can pause here to look through it. This is just what I said on the last slide, so I'm not going to read through the whole thing, but you should take a peek at this That's this table because it sums up the pulmonary system very succinctly. Now let's get into the arteries, right? Because the pulmonary circuit, super easy, super short, but the systemic side is much more complicated. So we're going to talk about the major arteries we find. A good chunk of these, if you know your regional terms, these are not nearly as scary, right? Some of them, the names may not be as obvious, but a good chunk of these, the name alone tells you what it is, what it's servicing, right, where to find it. So we're going to work our way down. We have the vertebral ones, right, those are going to service the vertebra, but then we have the right and the left common carotids, right, right and left common carotids, right and left subclavian. We have the brachiocephalic trunk, right, which is coming from that aorta. The left common carotid is also coming from that aorta, and the left subclavian is coming from that aorta. So those three are branching off of the aortic arch. So we have the ascending aorta, the aortic arch, and then that's going to come down around to form what's called the descending aorta when it comes back down behind the heart. Right? We pass through the diaphragm, we get to the celiac trunk, which we think about the upper digestive organs, the renal arteries, and then we have the superior mesenteric and inferior mesenteric, which will also service the GI system, gonadal, common iliac, which is where we're branching off, internal iliac, which is closer in, right, into that, around that ilium, right, the external iliac, so we're coming down into the leg. We have the femoral and the deep femoral, right, those are coming through the femoral region, the leg. Descending genicular, which is wrapping around. Popliteal, which is running, this is behind the knee, this is the back of the knee. Posterior tibial, which is running behind the tibia. Anterior tibial, running in front of the tibia. Fibular, which is running along, right side that fibula. You can see it's very faint. It's the one that's back here behind the tibia and near the fibula. The dorsalis pedis, and then the plantar arch, so this arch that goes around the plantar region of the foot. Right, so those are the lower limbs. So if we look at the upper limbs, right, so going down this way, we're looking at the arm, right, we had the brachiocephalic trunk coming up, the right subclavian, which is then going to reach in and become the right subclavian. Then it's going to come down to form brachial, right, the brachial artery, and then radial and ulnar, which are just named for the bones that they follow, and then the palmar arches. So there's a lot on this list. Oh, I almost forgot because it was on this side, the axillary, which is like the armpit region. There's a lot on this list, but if you've been paying attention to your regional terms, and you've been practicing those and you understand those, then this is not as hard as it looks, right? Because again, a lot of these are using the terms for the regions they're found in, like brachial, radial, ulnar, popliteal, right? So we're seeing those things again, right? And so either A, this is going to not be nearly as difficult as you thought it would be because you've already studied your regional terms, or it's going to at least give you more practice with those regional terms if they haven't really solidified for you yet. If we take a deeper look at the aorta, right, because this is something I pointed out in the last one, but now we can really see it. So this is like right where we're exiting the heart. Right, the first arteries we see coming from the aorta are the right and left coronary arteries, right? So the heart puts itself first, right, and it's going to service itself with that fresh oxygenated blood. And then as we come up, we form the ascending aorta, the aortic arch, because we do that loop down, that loop around, the descending aorta going down towards the abdominal aorta, because it's going to run basically that length of the body. And then coming off of the arch, we have our three main branches. We have the brachiocephalic, which you think arm and head, right, brachiocephalic, left common carotid, and left subclavian. right? This brachiocephalic will then break into two and become the right carotid and the right subclavian, right? So this is the only like one that has a weird like addition or like a go between compared to the left carotid and subclavian. So the right carotid and subclavian are coming from brachiocephalic artery. And so this is just going to kind of tell you a little bit about the components of the aorta. I'm not going to read through this because this is just describing what I did on the other slide. So if you want to pause here and read through it, you're more than welcome to. But for sake of time, I'm not going to do that to you because that's just too much, right? It's just talking about all the different sides, all the different parts of the aorta. If we look at what's coming up from the head and neck, so we have those common carotids that are then going to split into the external and internal carotids, and then right where they split, we see this carotid sinus, kind of like that bigger, kind of thicker area. We have the lingual, which is going to serve as things like tongue, right? The vertebral, which is running along the vertebra. We have the occipital, which is running along the occipital bone. The superficial temporal, the maxillary, which is coming up from there and surfacing the upper, like that maxilla region, and then the facial, which is kind of doing like going up and around the mouth, right, up along the nose there. So not too crazy, because again, most of these are named for what they're associated with. And then we've seen this picture before, but just as a reminder, the circle of Willis, which services the brain, where we have the internal carotid that's going to come up and lead into this. The internal carotid comes up, and immediately we see a branch for the ophthalmic, the middle cerebral, right, the anterior cerebral and anterior communicating. And then coming down, like going posterior, right, we have the posterior communicating, we have the posterior cerebral, and then the basilar, and then the vertebral, right? So we kind of join up together and form this circle, hence the name Circle of Willis. So we're kind of bringing blood up through the vertebral and the internal carotid, right? It's kind of starting that process. This is a super long list. Again, I am not going to read you this entire list because that is just brutal. But if I'm pointing some out that like, okay, you should know these, I would say brachiocephalic, subclavian, you cannot get away with not knowing those. Vertebral, common carotid along with the external and internal carotid. And then knowing some, like what the Circle of Willis is. And then it'd be nice if you did know the different parts of the Circle of Willis, but you should definitely be able to identify the Circle of Willis in general. The ones I didn't mention on here is the thyrocervical and the internal thoracic. The internal thoracic is just sometimes called the mammary artery, so you can imagine where it's going to be, right, and what it's going to service. And then the thyrocervical is going to be the cervical region for the thyroid and whatnot. Everything else I kind of already mentioned while talking through the pictures from the previous slides. So now getting into the thoracic and the abdominal region, right, as we're coming down. So we have our internal thoracic, right, and then branching off of the aorta. I'm gonna start with the aorta and then work our way down. So as we come down the aorta, descending down through the thoracic and abdominal cavities, we have all these branches. We have the bronchial, which again, named for what they will bring, the esophageal, the mediastinal, and the pericardial, all named for the regions or the objects, the structures they support. We have the aortic hiatus, which is basically the hole that the aorta passes through in the diaphragm. We have the phrenic, which runs along the diaphragm there. And in the celiac trunk, we have the left gastric, the splenic, and the common hepatic. And so those are all kind of servicing some of these major organs in the upper digestive system, so like the stomach, the liver, and the spleen. We have the superior mesenteric and the inferior mesenteric for like the intestine. We have the renal and adrenal, right, again named for what they service, right? Kidneys and adrenal glands. Gonadal, which will service like the gonads. Lumbar. The median sacral, which is again running down like the middle of the sacrum. And then the common iliac. And then the common, and you'll notice like if it's common, that means like that's like the start, and then internal and external can branch off of the common. So we saw that with like the carotids, right? The common carotid, which then split into the internal and external carotids. We see the same patterning with the common iliac, and then branching into the internal and external iliac. And that's really like all of the ones here. We covered them all pretty quickly. Lastly, almost forgot, the intercostal. They run along in the space between the ribs. Right, but that's really, again, most of these are named, you just have to like remember your regional terms, and then the ones that are like really close to each other, yeah, you'll have to practice. So like bronchial versus esophageal, that might be a little trickier to know who's who, but you at least know where to start in terms of like what region. You can eliminate a lot of the other blood vessels. So again, this looks like a lot, but if you know your regional terms, a lot of the work is already done. You just have to get the fine-tuned detail. And so if we look at the other branches, we have like visceral branches, right? These are going to serve the viscera, the organs that we find in the thoracic cavity. The bronchial will serve the lungs, right? The pericardial, right, will serve the pericardium. The esophageal will serve the esophagus. The mediastinal will serve the mediastinum. The parietal branches, sometimes these are called somatic. This will be for like the wall of the thoracic cavity, the vertebral column, and then the superior, the top surface of the diaphragm. Intercostal go to the muscles that are found between the ribs and the vertebral column and whatnot. Then the superior phrenic, this is going to be for the superior surface of the diaphragm as well. Right, so parietal and superior phrenic arteries kind of like work together. So we look at a flow chart, right? This is like a nice little flow chart showing what, like how blood is branching off. So if you were looking at that previous picture and you're like, it's a mess, I can't, this can at least help you organize it. Everything on the left is unpaired, everything on the right is paired. So on the unpaired side, right, we have the bronchial arteries, the pericardial, esophageal, and mediastinal. The left gastric, the splenic, the common hepatic, the superior mesenteric, and the inferior mesenteric. So those ones you have only one, right? Only one for them. And then on the paired side, like the intercostal arteries, there's one going left, there's one going right. The superior phrenic, right? There's one going left and right. All the way down, adrenal, renal, gonadal, right? Those make sense because like you have two adrenal glands, you have two kidneys, you have two gonads, right? And you have two sides to the like lumbar area. So those in the common iliacs too, right? You have two legs. So all of these are doubled because they're going, in general, one's going left and one's going right. If we look at how we continue to branch out, we have, so like at the very bottom of the abdominal aorta going through the common iliac, we have, this case we're looking at the right side. This will also happen on the left, right? So we're just looking at the right so it's not a mess and we're not just repeating things, but keep in mind what we see here also happens on the other side. So we're going down the limb, we're going into the leg, we see the right common iliac. This will split into the right external and right internal iliacs. The right external is going to do the lower limb, whereas the right internal is going to do like the pelvis region, the gluteal region, right? Just kind of like the rest of the pelvic bowl and the buttocks. And from there, right, if we look at the right internal iliac, because we already talked about what happens on the external side, we talked about popliteal and like posterior tibial and all that. On the internal side, we have the superior gluteal, which will be for like the muscles that form your hip joint in your hip. The obturator, which will be your ilium, your hip, thigh muscles, hip joint, and then the femoral head. And then the internal pudendal will be for the rectum, the anus, the genitalia, and then the lateral sacral will be for the skin and muscles we find in the sacral region. And again, this is that long list. I'm not going to read it to you. Most of these we've already talked about to some degree, and talk about like what they go to. So you can pause here and look through all of these. There's a couple that I haven't pointed out, like the cystic artery that goes to your gallbladder, which is another one that I didn't. The ovarian and testicular, this is just going to go to those particular body parts. Those are really the only ones that I haven't pointed out, right? The only thing I will point out here too is like gonadal arteries, like the general term for the blood vessel that supplies the gonads. Depending on if a person has testes or ovaries, then we can describe it as the ovarian artery or the testicular artery. That just depends on the individual person. So for the sake of clarity, I'll say gonadal artery. I'll just assume no gender. I'll assume no sex when it comes to something like a test, right? Because more than likely you won't be able to see that. You'll just see a picture and you won't necessarily know if they're male or female. So for the sake of clarity, I'll just use gonadal artery. If we look at the upper limb, right, so the right subclavian comes around, then turns into the axillary, the humeral circumflex. This is named humeral circumflex, right? This name tells us what it does because it is in association with the humerus. Circumflex, it goes around, right? So we see it forms like a loop around the humerus. We have the deep brachial, which is like deep, like right up against the bone in the back there, which then branches into the brachial. We have the ulnar collateral, which is like, see that like triangle that we're forming there? It's kind of near the elbow. And then we branch into the radial and the ulnar. So each of those following their respective bones, and a blood vessel will actually run between them to the anterior crural interosseous, which is that interosseous membrane that holds the ulna and the radius together. And then we have the deep palmar arch, the superficial palmar arch, and then the digital ones going into the fingers. Looking at the neck and upper limb, again, this is the same type of picture we saw before. Just if looking at the actual picture of the blood vessels looks messy to you, this is just putting it in another form for you, showing how they branch together. Again, we're looking at the right side, but this can be copied over to the left as well. So whatever we see here that's happening on the right side of the body, which shows on the left side of the slide, we would see opposite as well. So we have the aortic arch. We branch up to, in this case, the brachiocephalic trunk, which then branches into the right common carotid and the right subclavian. The right subclavian branches into the right vertebral to service the spinal cord and the vertebra. The right subclavian also branches into the right internal thoracic, which will then service like the skin and muscles we find in the chest and abdomen, the mammary gland, the pericardium, and the right thyrocervical trunk, which again will be for like the muscle and skin in the neck, the thyroid, right? And then the last branch of the right subclavian is the one that actually goes into the arm, which is the right axillary for like that pectoral and axilla muscle, so the armpit, the right brachial, right, which is going to move down toward the arm and elbow, and then right radial, right ulnar, and then the palmar arches and the digital arteries. And again, this is just a table describing the same things. This is just describing the same things that I talked about before. So if you want to pause here and read through this, you can. I'm not going to necessarily. I already described this in the previous slide. If we look at the lower limb, we have the common iliac, which then branches into the external and internal iliac, the lateral sacral, and the internal pudendal, which will be coming from that internal iliac, as well as the obturator. Those three branch from the internal iliac, whereas the external iliac will move down the leg. We have the deep femoral and the femoral artery. We also see the lateral femoral circumflex. Similar to what we saw with the humeral circumflex, we see that we have some that wrap around the femur in this case. The genicular, which will run around that like medial side of the thigh, and then the popliteal, which runs back behind the knee. The anterior and posterior tibial, again named just for the bone they're associated with and their location. The fibular, which runs along the back side of the fibula, and then the dorsal pedis, which runs like the front of the ankle, and then the dorsal arch. Right, so nothing too crazy. This is just the back view, so now we can see the popliteal run down. We also see the perineal running this way, and we can see like the fibular and the posterior tibial in a better view. And then we can also see the plantar arch, which again runs along the plantar side, the bottom side of your foot. And so this is just that flow chart describing this, so who's branching from who. So if it wasn't making sense to you in the picture before, this may help. Again, just external iliac will then branch, the common iliac will branch into the internal and external. External is the one that leads to the leg, so femoral will serve the thigh. The descending genicular will service the knee. The deep femoral will be for the hip joint, the femoral head, and then the deep thigh muscles. And then from the deep femoral, we have the median and lateral femoral circumflex, which again it's circumflex. It's wrapping around the femur. And this is going to serve some of those muscles we find like in the inner thigh and the quadriceps. Popliteal is the leg and the foot, right, running down the back of the knee, which then will branch into anterior and posterior tibial and fibular, perineal, and then down at the foot, the dorsalis pedis, the dorsal arch, and the plantar arch, and then of course the dorsal digital, so going into the toes, like the dorsal metatarsal, dorsal digital. Same thing we saw with like the hands, basically, very similar. And again, this is just the table explaining everything I just talked about, so no reason for me to just read to you. If you want to pause here, you can, or if you want to look at this in your textbook, you can. But these are just kind of explaining what these blood vessels look like, where are we finding them.